guys, so I've made you this video so that we could do some stretches that will hopefully help prevent injuries and get people better mobility. Right, so I've picked some stretches and the video that follows is going to demo how to do them, and I'm going to talk a little bit about why I've chosen the stretches that I have. So up first, we're going to stretch out the feet and the ankles. The feet are at the foundation point for pretty much any movement that's on your feet, and ankle mobility and feet mobility issues can cause issues further up. So like with knees, hips, lower back. So we're going to stretch out the feet first. You're going to sit back on your ankles like I have, on your tippy toes, and then you're going to rock slowly backwards and forwards if you want to extend that stretch a little bit more. Then you're going to push up into the bear squat. So put your hands down in front of you, put your bum up in the air, straighten out those legs as straight as you can get them, and work on getting the feet as flat on the floor as you can. You'll also feel this all the way down the hamstrings and the backs of the legs. You're going to hold that for 30 seconds or so, and then you're going to rock back to the feet, and you're going to repeat this 3-4 times, just as many times as you need to. Right, up next, we've got half kneeling groin and ankle stretch. So this is keeping the mobility in the ankles in, like we've just talked about in the stretch before, and we're also going to address adductor tightness, which is a hip flexor. So this can help, tight adductors and ankles can cause knee pain, ankle pain, lower back pain. So as you'll see, I've sat down on the floor. I've kneeled down on the floor. Then I have placed one of my feet offset at an angle to my body. As you'll notice, my foot is quite far out from my body. The further out your foot is, the more you're doing like the adductor and the glute. The further in the foot is, that's where we work on ankle mobility. So if you do suffer from knee pain, make sure you move your foot further out, because that will stop the knee from tracking over the toe and should prevent you from hurting yourself doing this stretch. Obviously, I've only demoed one side, you would do both if you were doing this stretch. Right, next up we've got figure 4 kickbacks. So this activates the glute and stretches out the hip flexors in both legs. So get your legs at a 90-degree angle, bent at the knee, and you're going to slightly lean over the front leg. You're not forcing yourself down, just like slightly lean over it. And this stretch is actually about activating the glute muscles. So we're not looking for a massive range of movements. Don't like force your leg. Your aim is to keep that foot up off the floor and keep that leg nice and straight. And then you just need like a tiny rocking motion, because we're just activating that glute. So hinge forward. You want your hands down in front of you, and then you want to keep that sort of belly button over the bottom leg, and then you're picking that foot up and you're just making that tiny motion. Right, we've got the active star stretch. So I've used a dumbbell for this, and that's just to try and keep my hip a little bit straighter. You can use anything that you've got lying around, some books, like, I don't know, whatever you've got lying around. You just want to try and elevate the knee a little bit so that hip's straight. And then you're going to keep your knee firmly on that, firmly on whatever it is that you're using. So I've put my hand on my knee, that's to keep my knee down, and then I'm going to put my hand next to my face and stretch out, twisting, which is going to twist the spine and open out the chest. So hold it for a few minutes at the bottom, maybe 30 seconds at the bottom, and then do it 3 or 4 times again, or just as many times as you feel as though you need. Right, we've got snow angels up next. This is to address shoulder mobility, gets rid of shoulder and neck tension, and which can cause pain in like your elbows and stuff. We're always looking at other joints. If you feel pain in a joint, it's probably not the joint that's the issue. We've got to look at other areas. So you're going to slightly lift your chest up off the floor. Remember the skydiving W to Y's? Kind of like that. Just slightly elevate the chest off the floor. And starting with your knuckles facing, like touching your body, you're going to, starting with your knuckles, starting with the backs of your hands down in the small of your back, you're going to slowly bring the hands out, up around to the neck, and place them on the back of the head, palms down. Right, up next we've got a wrist stretch. So this is going to help shoulders, elbows, upper back, and neck. The hands and wrists are the foundation for most planking sort of movements, push-ups, pull-ups. And often people find they get painful wrists and will blame it on wrist strength, but it can often be mobility issues in there as well. So you're going to get down on the floor, place your hands in front of you and twiddle the fingers back so they face your body. You're then going to lean gently forwards, but we're not forcing it. We don't want to hurt ourselves. So whatever mobility you've got, we're just looking to stretch through that. So just gently lean forwards, hold for a couple of seconds and then stretch back. Right, and finally, we've got a three-way neck hold. This is obviously going to relieve tension in the neck, the shoulders, and the head. So what you'll do is you'll put one hand behind your back and you're going to grab it with the other hand and pull it. So that, not too hard though, just so that it's as far over as it can go comfortably whilst being by your side. You're then going to look in the opposite direction from the arm that you've pulled into yourself. You're going to look up, hold that for a couple of seconds, look into the middle and then look down. Right, obviously any exercises that we've just done on one side, you'll do both of them and feel free to repeat them as many times as you need. Right, catch you in a bit.